the situation, but get out of the situation. I'm not scared even if some bacteria get into my body. I'm not scared. Bacteria does not spread germs or disease. Even if you know that founder director of tubercular sanitarium in Thambaram, very close to that there is a TB sanatorium. The founder director called a press meeting. All the media people were sitting. He asked them to examine 2 glasses of water. One glass was pure, another glass was filled with tubercular bacilli, the water. Through the microscope they can see that. He asked them, they say germs cause diseases. If I drink this water, I should get tuberculosis. Right? Everybody said, yes, don't do that. You don't have to prove anything, don't do it. He said, I am going to drink it to prove that it does not cause tubercular bacilli. And he drank it in front of 200 people. And it was in the press, everybody published it, to show germs don't cause disease. Your immunity to disease is not there, but you have to have a healthy body, that's all. If you have a healthy body, germs will not cause disease in you. That's what he proved. Again and again we are seeing, even the doctor who answered me, he says there is a stage of predisposition where the disease has already started, the germs will be produced out of that, the germs will eat the filth that is there accumulated in the body, they will also multiply. We need more volunteers, come on, we have to clean up this place. That's what happens, germs multiply, oh my God. A person from Goregaon, he went to Mumbai city to visit his relative. And when he visited there, first day the cousin said it was a holiday, tomorrow I have to go to work, come with me. He said, lot of crowd, don't get lost, keep watching my wrist like a red band I am having. Keep watching my wrist, I will be showing like this, and don't get lost. Whole day he went around and came back, he said, did you see all the town I showed you? No, what did you see? I was seeing your wristband. He was taken to the town to see things, see places, but he told him, don't lose track of my wristband. He wore a red kerchief in the hand, and he said, what did you see? I saw only wristband. You are scared of something, you are seeing only one thing, you are not seeing the truth, or you are not seeing the real outside. Next day, he went to work, he says, these are the buses going to different places, see this place, this place, and he goes away. Next day he goes and he sees a house on fire, and in front of the house there is a red truck. On the red truck it says fire truck. He says, oh my God, the fire truck comes in Bombay and sets houses in fire. He goes to another bus, another area, he sees another house in fire, and a truck is standing before that, fire truck. He immediately catches the train, goes back to his village. Oh no, that's not the place to be. What happened? You were supposed to spend a whole week there. No, Baba, that's enough for me. Because what happened? In the Mumbai, there comes a red truck which sets houses on fire. I saw it in 2 places. The house was on fire and the fire truck was there, it said fire truck. Now you are laughing because he doesn't know what it is. We have to laugh at our own selves because we think germs cause disease. Germs are the products of disease. Germs are coming to remove the disease. Germs are coming to remove the diseases. We are all thinking germs cause disease and we are laughing at that fellow who is foolish. Let us awake. Germs are coming to remove the disease from us. We become healthy. So we don't have to bring germs and put in our body. Keep our body clean. Help the body to become cleaner. The tona which I was talking about is a mini enema. Use the enema can whenever there is an emergency situation. In a situation where there is severe pain in the stomach or any part of the body, use this emergency situation. Use some water, send it through the rectum, hold it in the colon for some time, and when it comes out, a lot of gases comes out, and the exit door is light comes out. You know exit door light? In a dark place, you know how to get out. Inside our body, the filth is accumulated in different places. Oh, the exit door is there. So they all turn their direction and come to this place. I was having a health center in Delhi, and while I was in the office, people come for consultation, and there is a outside waiting lounge where there is 2 benches. One bench for meeting me for consultation, another bench for outdoor patients. The outdoor patients get a number. And my friend came to meet me. He didn't know what line is what. He sat on the outdoor patients line. He was given number 19, and he was waiting and waiting. New people were moving. When his turn came, they took the number plate and put him inside. And when he went inside, he says, "Where is Dr. Arun?" "Shh, don't talk. Lie down. No noise here." He made them lie down. He made him lie down, and he gave him a toner. No, the pain is not there, the pain is here. He said that that's not the pain spot, pain is here. And after that he go and eased himself, and pain is gone. Wow, he took the pain away from there. He thinks that he put the tube and sent something inside and took the pain out. All the causes is right there. Accumulated filth. It may be filth, maybe here, filth may be here, anywhere. But as soon as the exit door light comes on, all the filth changes their direction towards that exit door. Now you are relieved of pain. It's a simple technique, but it solves great misery. Acute trouble has also gone up. Yeah.
Hi, I've got a question. What about like muscular pain or
Yeah,
any
all
bones
the
fine,
pain.
bifida?
This gives you immediate relief from pain, and you can put a wet cloth on that spot, expose it to sunlight for some time, and then put a wet cloth or clay. You wet the clay moist clay and put it there, wrap it with a cloth, and it will suck out the toxins, pain is gone.
What about
But you have to change your food.
fermentation though? Fermentation.
No. Fermentation also removes pain, but it will leave you distended. The nerves will keep distended. In winter, you have to do that.
So just say babies are born with a problem, some sort of disease, well, not healthy body, and is that due to the mother, because obviously it's in the mother, and then she's transferred all of that to the baby? So when they're born, when they are very, very sick babies, is that due to their little house at the time?
Yeah, sickness of mother is transferred usually to the child if they are sick during the pregnancy.
Okay.
I come in India, and when I back to my place after 2 years of vegetarian, I was a bit anxious, so I made some exams and everything perfect. And 2-3 months after, I lost 10 kilos, and I don't know why. And some months after, stomach perforation. I don't know the word in English, ulcer. And then I should have taken, for this operation, I lose 4 kilograms. And after I should have taken 14 kilograms, my weight, but nothing. And I still don't know why. And no examines are able to do anything to tell.
You see, whenever there is a perforation in the intestine or the stomach ulcer they call it, so you have to give fasting to allow it to heal. If you keep on eating or something, then it will not heal. So you expose to sunlight from outside, the sun rays will transmit their sunlight energy inside, and you apply cold pack, and you take no food for some time, and sometimes you will take only vegetables, fruits, things like that. It eventually heals.
Cold pack.
Cold pack. Wet cloth and wrap it. Wet cloth.
Le tissue floor.
Wrap it. Either cloth or a clay or vegetable, you put it and wrap it up. Then it cools and takes out pain, no pain. For any healing, you cannot resort to any one thing, like a wet pack or a tona or this hydrotherapy or solar therapy. You have to do them all because everything together is lifestyle. You need sunlight, you need air, you need water, you need proper food, you need exercise, and you need rest. So what about coma? A patient who is in coma, there was a patient in coma who came back to senses in just 3 days. Earlier he was in medication, and then when he came to coma, they didn't do anything. They just kept him feeding through the, intravenous. When we went there, we took out all the tubes, no intravenous feeding. We let him fast, and we put a wet cloth on the head, wet cloth on the belly, around the belly, and we took him to sunlight for some time, and bring him back, and just keep chanting and meditating, fresh air and everything. That's all. Without giving any food, he came back to senses. If you give food, keep giving intravenous, he is never going to come back. He will be in coma for a long time.
No, so coming back to that other question and asking, so all these things, including that lady was talking about, they have this thing called German New Medicine. There's a guy called Dr. Hammer. A lot of things he says are very similar to what you're saying. But it looks like most of the proof for all this is anecdotal.
Yeah.
So somebody says, I saw one case like this
Right.
in this hospital, it happened like this. Why haven't these people been able to get together and
Record
systematize this research, and so that everybody is very clear? The answer, there is no trust or belief involved. If somebody can understand the research process, the answer is very evident there.
Very true.
This is
Right
not
now,
being done.
No, it has been done. The information is not available to everybody. If you want, such information can be made available to you. But what happens here is a big political game. And in this political game, you have to remember one thing. We as natural hygienists, we have a parameter. We cannot cross that parameter because we don't diagnose disease. We don't treat disease. We don't cure disease. Now if I say I cured diabetes, it's wrong. Who am I to say I cured diabetes? I can't say I cured cancer. I cannot say I cured any other disease. They come with this report, diagnosed by a medical people. I don't care if it is diabetes or arthritis. I put the record in my drawer. He gives me a copy of his diagnosis, put it in the drawer, and give him the same treatment as an asthmatic patient or a rheumatic patient. Anything. We give the same treatment, we tell you ahead of time. There is my team in Pune, they hold diabetic camps. Many people come to get cured from diabetes. And after they registered and they come in the assembly, they say, we have to confess one thing. We don't treat or cure diabetes. What? Everybody is getting up. He says, this is a record of previous camp. People came with diabetes. We don't know what diabetes is. We gave them this treatment. Now all their letters are here saying that we don't take insulin anymore, no metformin, no medicine. We are free. We are living a normal, healthy life. If you want to continue this track, take this camp, you are free. Otherwise, you can take your refund. Nobody went back. They all tried. They also have given endorsement. We don't know what we are doing. We are not treating any disease. How can we claim that we cured cancer? A patient came to me saying that she has a tumor here. We saw the tumor. We treated her. After 28 days, she had to go for biopsy. Her biopsy was within 1 week. I told her to postpone it for a month. And the doctor readily agreed. Oh yeah, that would be good. Because one thing is operation theatres are not available. Another thing, she is a nurse working with him. He's not going to get any extra money from her. And he knows another thing is insurance will pay them, and her tumor will be bigger after 1 month. So he allowed her to come after a month. After 1 month of nature cure treatment, she goes there. There is no tumor. They take X-rays, maybe a small tiny bit inside. 26 X-rays, there is no tumor. Can I say I cured cancer? I don't know. They say we don't know if it is benign or malignant unless we take a biopsy. There was no chance. I said, don't go for biopsy, postpone the biopsy, come for nature cure. I don't want to claim that I cured cancer. It may not have been malignant. I don't care. All that I care is that she was not subjected to any chemicals or medication. I don't want to claim anything. All that I say is I don't want proof. I want to tell you one proof. Health comes from healthy living. Do you need any proof for that? That's all I'm asking you. No matter what your trouble is, don't diagnose them. Don't check your body. Check your habit. Is there any problem? If you change your habit, your health comes better. If you improve your lifestyle, you are healthier. You don't need any scientific proof for that, right? Do you want any record?
But you would be able to help more people.
Pardon me?
You would be able to, sorry, you would be
You
able
will help get the cynics come easily to your side when you have that kind of scientific approach to establishing the thing.
I know. But the strength of the truth is so much that everybody will comes to us. Who comes to us? Do you know that? Nobody comes to us with headache or stomach pain. Nobody comes for minor ailments. After they have tried everything, they say they're doing something. Okay, let me try. As a last resort, they come to us and they get well. They go and speak. We don't speak. Here itself we have people who have undergone this treatment. Her mother-in-law and so many others in our classes, they have gone through this, and that's why they come again and again. And those are the people who are our, what do you call them? Advertisers.
Certificates.
Certificates, ambassadors. You are very right. You can't get people without showing them proof. We don't want to worry about it. Truth alone is enough for us. We only ask one question. Does it need a scientific proof to tell you healthy lifestyle improves health? Is there a problem in improving health? No. Is there a problem when you say that if you improve health, your disease will vanish? That's where you have to think.
And also even scientific proofs are changing after every time. So what is the guarantee that that is the correct one?
That's very
No, but there is
And they are paid by
One day,
the
for some time this medicine was nice,
Yeah.
and then there's something else there. And they keep on
drugs
changing.
of
True
yesterday.
scientific approach, when it finds that the previous report or study was wrong or limited, it will accept it and try and go forward rather than sweep it away or try to put only their view onto it.
Yeah, I understand.
Okay, let's see the span of 100 years. Wonder drugs of yesterday became the blunder drugs of today. Every year, if you check the Department of Health, they discard 60 to 120 medicines every year from the market. 60 to 120 medicines are taken away as dangerous. The same medicines come in another form, another name, another color.
And that they are not universal. One country approves of some medicine, the other bans it.
Third
No,
grade.
it's like then saying penicillin or other things have not been useful and it's just a myth that is being created. So if there are a lot of studies and reports to show that these things are working and we strongly feel they are not, you need to counter that then. Otherwise, you're expecting people to believe. So this vaccine story, when I heard it a few years ago, I was shocked. So I tried to do some little internet research on my own. And one thing I could find was that at least some reports and data is showing that polio has come down, right, after vaccination started. It has not been eradicated, but data seems to show that the incidence of polio has come down. Then how do you explain this data then?
And then there is
All that I
more
explain
data.
is, what about the different kinds of diseases that polio vaccine has created? That's also in the record that you fail to see.
So you have to then show a causal mechanism for that, na?
See,
So
our
if you're
job
saying,
is
for
not
example,
to
autism
criticize
is coming from polio vaccine, you have to show the causal
the
mechanism.
Our cause is not to criticize the medical industry. Let them flourish. But our cause is to show that our science is genuine. That's all we can do. We don't know about them. How can we criticize this or that? We only see from the records. Every website shows different departments of health. This took away 60 drugs from this market because they are dangerous. Every year doing it. Is it new to you?
No.
You have to go and check. I don't have to criticize them. They are themselves saying it. Our job is not to criticize them.
But you can also find so many pills and drugs which are being continued to being used after 100
In
years.
different
for
names.
example.
Okay, even if they are being continued, see their own pills, packets, in which they list you the side effects of each pill. Do you still want to take them?
No, technically, those side effects are also listed there to protect them legally. So it is not that everybody who takes those pills will get side effects, even one out of the
Is there a
12.
study? There is no such study.
I have taken
I've
so
been
many-
seeing him taking pills for so many years and he's all right. He's not all right. Ask him, ask each person if he's all right. He has got so many problems. But he's living with the problem. They teach you how to live with disease. We teach you how to live without disease. If you have this problem, take this pill also. Take this pill also. One started with a headache, now it has become a blood pressure problem, now it has become a cholesterol problem, then thyroid problem. All these associated problems.
No, how the symptoms are appearing, the side effects are appearing on the box, is during clinical trials, if out of, let us say, 10,000 people you do it, even if 20 or whatever a statistically significant number get a certain thing, it will come into his list. So it doesn't mean that the other 9,980 or 9,940 were also affected by this. And this they are
Only
doing
thing we
from a
don't know
legal
is
point of
only
view.
thing we don't know is whether you come in the 5% of people who died or you come in the 95% of that you have to take a chance, right? Oh, that's 95% people didn't die. Only 5% did.
Or can you
So
say,
wouldn't you take a chance?
Statistically, if you have a better option, you take the better option, otherwise you have to take the chance.
But you can't trust the
What?
statistics. It's our bias, the money.
There are two kinds of hypnosis. One is the hypnosis of allopathy, invasive cure. Another is the hypnosis of nature cure. It's a choice of the person which hypnosis one wants to
Here it's not a hypnosis.
what?
Thank you.
I'm
Thank
just
you.
getting a
It
Yeah,
is
yeah.
kind of, isn't it? I mean,
Okay.
Thank you. We've touched a lot about physical health and blood pressure, cancer. What about mental health? Bipolar disorders, body dysmorphia, stress, anxiety. Just because you can't see it doesn't mean it's not a health issue.
Our physical, mental and spiritual health is one and indivisible. We do not treat mental health separately from physical health. And a same approach, when we do pranayama and meditation, it relaxes the mind. When it relaxes the mind, it allows the body, biological activity go without any interruption. When we don't allow the body to, with fear, I have cancer, even the activities which are going, we are getting disturbed. Bipolar or any other stress-related problem leads to same body health. Physical health will improve mental health.
Okay. What about,
Mental health will improve physical health. Both go hand in hand.
but
We don't.
what about things like schizophrenia or multiple personality
Exactly.
disorder? Is that interlinked
They
as
call
well?
with
or-
different names. We don't have names. We don't have classification. We don't diagnose diseases. They're all the same for us. We had patients who were labeled as schizophrenic. We don't know what it is. We just treated them the same way. But every patient, we talk to them. I said every physical ailment is preceded by a mental ailment. Every one, not just schizophrenia. Every physical ailment is preceded by a mental ailment. Without dealing with, we cannot deal with physical ailment. How do we deal with mental ailment? by improving the overall physical health and mental health by doing pranayama, sun bath, and prayers within the pranayama. In our culture, breathing exercise is not done without prayers. It's included in that. In a cosmopolitan crowd, I don't introduce prayer of a certain religion because that's like disturbing your thoughts or your belief. In such gathering, I say some common Om, maybe assuming that it's not objectionable to some people. And in a class where there were some Muslim students, I asked them, is it okay if I use Om for meditation? They said, absolutely no problem. We are here to learn what you're doing.
Thank you for answering my question.
And they joined us, and one of the Muslim students came first in the class. So we don't introduce so many things into the mental stage because of cosmopolitan reasons. With one-on-one, if you come to me, I'll ask you your belief, and I will ask you to chant your religious quotations or your God, and I will focus your attention to get away from material problems. And when you are becoming peaceful and you are able to accept the food that we are giving, gradual changes will lead you to healthy life. There will be no schizophrenia, no bipolar, nothing at all. All these are creations of unhealthy body.
You might have to speak to all personalities though at different
Yeah,
times.
different personalities. They become all normal
Thank you.
over a period of time.
Well, there is study of what you're doing, and is there patients, and the one who study are their patients? Yeah.
Yeah, that's very, very important. Individual is a special, unique creation of God. Each person has passion for either music or a dance or something, and if he forms his lifestyle in such a way to promote his passion, then he will be more successful. No health problems. He will be free from most of the health problems. And then whatever good suggestions we give about health will be accepted easily. Because he doesn't have a goal, because he doesn't know where he is going, he is confused. The confused people neither get health nor wealth. Duvidha mein dobu gayo, maya milau naram. That's a saying in Hindi. In confusion, you neither get health nor wealth. If you're not confused, you will get both health and wealth. Both will come to you.
You want to say something about kidney, then they're asking some questions. You started, then they're raising questions.
So I think he was maybe meaning patience instead of passion.
Yeah, we know that, but...
Oh,
sorry. Yeah.
Oh, can you say that question again?
Yeah, is the one who study what you teach are patients?
Patients.
Yeah. Or is that two different part of what you teach?
In nature cure, we don't have patients. We don't have a disease. So we have students and teacher.
Okay.
The real meaning for the word doctor is teacher. We have to teach the patient healthy lifestyle. That's all we do. Okay. So if there is any more questions?
On this tuna thing, can it be made as a part of one's lifestyle itself? Because there's tuna.
Tuna, initially you take once in a day for 15 days. After an attempt to a natural motion. Don't take it without an attempt to a natural motion. After 15 days, take it alternative days. And then after that, you take twice a week. And then once a week, you can continue to check that your elimination is good. Once a week, you check it out. If it's okay, then you don't have to take it. That's the procedure to take tuna.
Would you say the amount of food your body needs is related to your age?
Well, yes and no. If you chew your food thoroughly, you will know how much to eat. You will never be able to overeat.
because I think I'm always overeating.
It's a sudden problem.
You will be able to stop. You will be satiated before it comes overeating.
I see.
That's the only
Overeating
thing.
as well as
Eat only when you are hungry and chew your food thoroughly.
You said to be a student. How many times you have heard about 3 weeks? What is that? Is that what I have heard or something
About what?
I've imagined?
About?
To be student.
Student, yeah.
Yeah, I've heard about 3 weeks.
Yeah, this course is for 3 weeks.
3 weeks.
Yeah. In Pollachi, near Coimbatore. Coimbatore is a station.
Yeah, I know.
1 hour from the railway station is Pollachi.
About 6-7 hours from here.
From here, 6-7 hours by drive.
Okay. And 3 weeks is there regular
Residential camp.
regular session?
Yeah, from morning 6 a.m. to night 6 p.m.
Yeah, but when is the next 3 weeks session?
From tomorrow.
Next session.
Tomorrow.
After that.
Next year again I come January.
In January?
I come again next year January.
In
Pollachi. I'll be conducting classes in Coimbatore, in Chennai, Pollachi, Bangalore, and some people are asking in Mysore, Delhi, and Pune, and different places.
Oh, so there is different place for you to.
Is this the last one? So
Yeah, this Pollachi is the last one, and then I
this
go
year,
back to
then
USA.
you go back
This
to
year.
America.
Back to USA.
Get my thumb out. See if I can get there tomorrow.
6 months ago, I meet a girl here in Oroville who was a breatharian.
Yeah.
And she actually went for this one 10-day course. And then now she is only having one glass of juice or something like this, estimated about 200 calories. And apparently, and this was after 6-7 months, and she's keeping
Taken out those things. We don't do that. But body itself has to work its way through. And then it was wonderful. So many kidney problems were there. One elderly person having edema all over the body, and his protein was coming out from the urine. They examined and said, we didn't examine. So we said, we will give him only herbal juice, only leaves, dilute juices of herbs, and spinach or some other amaranth, some leafy juice, will dilute it with water, use it in the mixie and give it to him. You know that in homeopathy, they have potency. You know what is potency?
more dilute thing.
Yes, exactly. If you want spinach, you put 1 drop of spinach juice and add 99 drops of water and churn it in the mixie for 2 minutes, 600 revolutions per minute. Then 1,200 revolutions it got. Then you get 1 drop of that juice is 1 potency. Add it to 99 drops of water again, dilute it and churn it in the mixie. Now you get 2 potency. Is stronger than 1 potency. Where is the spinach juice? It's gone. We think there is no spinach in this, right? They are going on diluting it for 24 potency, and it goes on becoming stronger and stronger. Is that right?
Yes.
Here we have a homeopathic doctor. Yeah. So the dilute you make, it becomes higher potency. What did we what do you dictate in the morning?
Vital food. Vital energy.
Subtler the food, higher its potency. Same is the process we do for patients who had edema. Protein through herbs we are giving, but dilute one. Churn it in the mixie and give it to them. Works wonders. A woman had gallbladder stone, severe pain. My own daughter-in-law was that. And from the hospital, I told them on the phone, take her out of the hospital, I'm coming. From Florida, I took the first plane and went there. and gave her 1 glass of tender coconut water, churned with 1 drop of neem leaf. Just 1 drop of neem leaf, churned several times and gave it to her. What does the neem leaf do? It's diluted. It tickles the liver. It activates the liver to work. And when we gave her, all the pain is gone, just in 1 dose. Severe pain. We didn't give juice of neem leaf. We just put 1 drop in 1 glass of tender coconut water. So it works wonderfully. You don't have to give a lot. A little bit works wonderful.
Even young children can give tumors?
Yes, definitely. We have a smaller version. I don't know if we have it here, but you can buy a syringe and take out the pump and hold the syringe glass up, and it will drain out without violence. Attach a catheter to the syringe.
I wanted your views on a couple of products. One is moringa and the other is apple cider.
Beautiful. Cider is fermented, right? I prefer to eat the apples rather than the
No, but then they say a lot of fermented food is good, including all
it
this
is good,
miso
but
soup, yogurt,
artificial.
this, that.
There are so many preservatives and artificial things in the ready-made, marketed commercial food. But if you ferment the apple itself and make cider out of that fresh, that may be okay. But the commercial processing, I'm not so sure about.
And moringa?
Moringa is also strong with protein, and that also is too strong. Unless you dilute it with enough water, I don't prescribe or advise people to take it. Very strong. If you take a strong juice of moringa, you will vomit off everything. You will throw up. Very, very strong. But some people make a decoction of it, and if you don't get sleep, it will make you lie down flat and like a log you will sleep. But that's all violent. We don't prescribe such things.
And people also talk about lots of guava. That you recommend.
Yeah, guava fruit, any fruit is good.
So this tuna, you use a normal enema can, is it?
Yeah, no, it's a smaller version. Anybody in for a little bit pranayama and meditation?
Yeah.
Can you play that music?
Please.
Without the mic also.
Please.
One more question.
Yeah.
For participate that 3 weeks study, where is possible to sign or something?
Yeah, send me an email. I'll forward it to them. They will send you a reply.
Starting tomorrow.
Tomorrow.
In Coimbatore.
No, but you can, if you know how to come to Pollachi, then I will give you a phone number. You can call them and you can reach them.
Can we take it downstairs? Can you share it?
How do we get there?
Pollachi camp. Telephone number.
98940 13579.
One paper?
98940 13579. Anant is the name.
98940.
Strike my light on.
1357. 13579.
Is this the number for the camp?
I spoke to the medical journal.
You were saying some people come only for the second week, only for the third week.
Yeah, some people are coming for the third week, some people are coming all 3 weeks.
So the naturals to get on this week.
Hold the breath. Breathe out. On your own pace, do it 5 times, 5 units. Just when you're ready, you can move your limbs and gradually get up and sit. Is it good? Diseases are divided into 3 stages: acute, chronic, and destructive degeneracy disease. The acute stage is your friend, because there is severe crisis like coughing or vomiting or diarrhea, severe headache, fever. All those symptoms are severe. In the severe stage, that means it can be cured very quickly. The acute crisis of pain or destruction and distress can be removed very easily, quickly. How do we do that? One is a toner, another is a wet pack, another is breathing exercise, walking out in the open air, and we take hydrotherapy like wet packs, mud packs, vegetable packs. All those will remove pain immediately, instantly. And then for every acute crisis, you have to fast. Fast until normalcy returns. Why should we fast? Because feeding in fever is feeding the fever. Feeding in fever is feeding the fever. Whenever food comes into the body stops all other activities and attends to the food first. Food has to be digested, otherwise it will rot in the body and become poison. So the priority of the body is to deal with food in the body. So it's better not to eat food until the crisis ends and normalcy returns. The biggest problem in this is a misnomer that food gives energy. Many children or adults who fall sick are forced by the family members to eat something at least. Otherwise you will become weak. You're already sick, you have to eat at least rasasadam, ladam, pal, milk or bread, something or the other. They will keep on trying to feed you. That's the biggest danger. Don't do that. If they are sick, just leave them alone. Until they are healed and normalcy returned, don't tamper them. Because the work will not be completed. They don't feel hungry at all. When you are so severely sick, you don't feel hungry. Even if you feed, it doesn't taste good. Palum kasanda dadi. Like that, when you are sick, even the milk is bitter.
What if your sickness is constipation? Would you not eat lots of fibre to get rid, or would you fast?
You have to fast and drink water in small quantities and take tona. Tona is a mini enema. You send through the rectum and it helps you to work better. Peristaltic movement improves.
Where would I get one of those?
You can get it in Chennai, is not far away from here, and from the Khadi Bhavan.
Even Pandi also available.
Yeah.
What? Yeah.
What has some?
Where?
It's in Mission Street. There is one shop where it is available.
What?
Tona cup.
Sir, do you recommend?
It's opposite to near that Diva, and that in the lane there is one shop called Chandra Sir is opposite to that. Energy Home, I think the shop name is.
There's a business opportunity in making one for travelers, a portable one.
Yeah, that's a small one. You can put it in a bag.
So you should call it Jadoo Tona.
Jadoo Tona.
बहुत अच्छे.
Yeah, sir, what
Magical one.
fruit juice fasting? I mean, you are advising water fasting.
Yeah.
Fruit juice fasting is also okay.
We don't call it fasting. We call it liquid diet.
Liquid diet is also okay.
Yes, it's approach to fasting. We are approaching towards fasting. Initially, people are not used to fasting, so they should do it that way.
What's the right way of
Instead of
fasting?
fruit juice, they should take tender coconut water. And instead of fruit juice, they can take fruits itself.
Fast food.
Okay.
Huh?
Fast food.
No, fruits.
I called it fastless. Fasting, but I was trying to pun on that. Bad shit.
What is the right way of fasting actually?
Huh?
What's the right way of fasting?
Right way of fasting? Not eating.
Water?
Yeah, just a little water to sip now and then when your throat is dry. Just because you are fasting, don't load your stomach with water so you don't feel hungry. Water is just a substitute. A little bit of water is to put in.
What will happen if we have more water? Like what?
It's not needed. You will be overloading your kidney.
And
Some
the
people are happy to have white urine, colorless urine. That's not good indication. If you get yellow urine, that means your kidney is working very well.
Yellow urine.
and when should you clean yourself? Like in the morning of the fasting day or in the evening before? Like get out of this.
Twice a day. On fasting day, you can take toner twice. Morning once, evening once. If you want to take only one time, you take it after the attempt to a natural motion in the morning, you take that. And in the acute stage of disease, fasting is very important, and taking toner helps in during fasting. And in the chronic stage, where the disease has been there for a long time, acute disease has been suppressed with medicines, so that's why the chronic disease comes. In chronic disease, we don't prescribe fasting. We prescribe approach to fasting. Gradually reduce the food, gradually reduce the intensity of the food, gradually reduce the number of times that you eat. That way, your body will come to a stage of acute crisis. Without the crisis, you can also manage. That's called non-crisis diet plan. Non-crisis diet plan is a plan where gradually you are coming to fasting with all these steps. And then when you are ready, introduce a full day fasting, and then again come back to eating food. Again introduce 2 days fasting, again eating food, like that. Up to 3 days fasting we can do, and repeatedly 1 day, 2 days, 3 days, 2 days, 1 day, like that. Rhythmic fasting is called non-crisis diet plan. By doing that non-crisis diet plan, you don't get any crisis at all, but over a period of time you come back to normal health. Diabetes is described as die-a-bit is diabetes. To die a little bit every day. So it's a terrible condition where if you get hurt anywhere and bleeding starts, it doesn't stop. If you are diabetic, you should be very careful not to get hurt. Sometimes there is a bleeding from the gums. That also keeps on bleeding too much. So how to cure diabetes? We don't cure diabetes, we don't treat diabetes. But there is an outline for such patients. Outline is give foods which does not need insulin for its digestion. 3 outline. One is give foods which does not need insulin for its digestion. Give foods which have material from which the body can generate its own insulin. And third one is don't give foods for short intervals so that the pancreas will get an opportunity to repair itself. That's the outline for diabetic treatment. Suppose you give the same treatment to an asthma patient, also it works. Just an outline to tell you what will produce insulin. That white ash gourd pumpkin has material called cuckoo breaks, out of which the body can generate its own insulin. And fruit diet, we give one diet of fruits, one kind of fruits in the morning, which does not need any insulin for its digestion, but carries the sugar to the retina, brain and liver. The fruit has got some water. That water is capable of carrying sugar to brain, retina and liver. You need a special kind of fluid for that. That's available in fruits.
All fruits are there or some?
Yeah. Fructose, because it's called fructose.
Light diet can be fruit.
It can be night if you want to choose. It doesn't matter where you choose.
How the mechanism activation of converting fat into sugar? If we fast, then the fat inside our body gets converted into sugar?
Yeah, carbohydrate. Everything extra in the body will be converted into sugar.
And which food produces insulin?
Sir, what is the third
White
thing?
ash gourd pumpkin or cucumber, watermelon, the white portion of watermelon, and all the families of cantaloupe, honeydew, all this. They have that chemical called cuckoo breaks. Don't eat any food for short durations so that the pancreas will get to repair itself.
Ideally 3 meals.
Yeah, ideally 3 meals. And we have problems like arthritis, rheumatism and all that. There the joints have stiffness and there is some fluid accumulation in that which is comprised of cartilages. That's like lubricant for the bones. And that cartilage quality is so poor because we consume salt too much and we cook salt. If we put salt during cooking, if salt gets cooked, then it retains extra water in the body. Particularly when extra water joins in the joints, then it becomes very, very painful. So for those patients, we particularly say that add salt after cooking in cooked food and have 2 meals where there is no salt at all.
Do you have some where patients can go other than these?
Yeah, production.
Other than only production?
That's not camp, it's a camp for some time, but otherwise they have a place to accommodate indoor patients.
Hi, my mum's just had a knee replacement earlier on this year, and she needs another one doing, and it's due to a lack of synovial fluid, so bones are sort of grinding on each other. Can she get that fluid back following?
We can't cure plastics. We can't treat plastics. The knee replacement is, they say the knee is paining, okay, we'll put a plastic, it will not pain. But the joints where the surrounding areas, that starts revolting against something which is not the body. So we can't treat the plastic, we can help to some extent that the body is quiet a little bit with a lot of good cells in the body.
That's just an old age thing, that's always going to happen.
So to avoid the knee replacement surgery, when they have that problem, is there something that can be done?
That's right, definitely.
What can be done?
It's the same thing for everything. Don't cook your salt and add salt in only 1 meal. Have 2 meals where there is no salt.
Can I also eat 2 kinds of fruits in the morning?
It's not bad, but eating one kind is better.
Have the other one the next day. Have one and then save that one for the next day. Mix it up.
In that disease also you can't keep fasting, but gradually build them to chronic stage and then chronic.
I have one more question. I use in my home. I used to make a lot of smoothies, where like green smoothies, where I put a lot of greens and a lot of different fruits. So would you say it's not good to mix all those fruits and vegetables together?
See, every action has 2 reactions. One is an immediate reaction, another is an ultimate reaction. In immediate reaction in this will be very good.
What does it mean?
Immediately you will feel strong and lot of energy. Ultimately, a drain of vitality because you have to digest too many things. Complex digestion.
So it's better to use less ingredients.
If it is all vegetables, okay. But the fruits is better to eat one time, one kind of fruit.
So you wouldn't even advise to mix vegetables with fruits?
Yeah, because the purpose is destroyed. Vegetables is alkaline, fruits is acidic, and though mixing both, neither you get acid nor alkaline. Some nutrition you do get.
I see.
Yeah, I do that in the morning as well.
Immediate effect will be lot of energy, feeling very strong.
It enables the body to generate insulin. How does that help with muscle glucose?
I'm sorry, I didn't get the question.
Sorry. The white ash of mention, you said that it enables the body to generate insulin. So how does that help in a situation?
There you go. Yeah, no, it's not that way. Whatever food ferments in the body, B12 or B12 things are produced out of that. Even the juice of white ash gold will ferment fast.
Why not? So unsocial if you don't want to change. No, you're
No papaya.
I can do as wonderful. It's really